Hello, this is Let's Talk Valdosta, and I'm Shara Denton with Marcus, and we are honored today to have Department of Public Health here today, Kristen Patton and Stephanie, and they're going to talk about the COVID numbers and the things that the community needs to be aware of with the growing numbers of COVID in our community. Welcome to the show, guys.
Thank you for having us.
Awesome. Now let Marcus go.
Well, obviously, we're seeing an uptick in COVID numbers again. We got your press release once last week.
Yes.
And plus, we see people in our coworkers being out and their family members and all that stuff. So we know that the numbers are going up. So what's causing this spike?
So, unfortunately, I'm the one that gets tagged with the job of sending out press releases as the public information officer for South Health District. However, Stephanie is our COVID epidemiologist, so I'm going to let her speak a little bit more on why we're starting to see this surge, since she would be the subject matter expert in this situation.
Thank you. So basically, the surges are from the variants. Viruses are very good at changing and adapting, and that's just what we've been seeing with COVID. I think a lot of us in our personal lives feel like COVID has been around forever, but scientifically speaking, it's quite new, and so some viruses change very slowly and some change very quickly, and that's just what we're seeing with COVID.
Okay. And I guess, obviously, the numbers are going up. But the numbers that you guys receive are probably not indicative of actually the people that are testing positive because of all the at-home tests. So what should we be doing as a community to kind of protect ourselves, or what should we be doing to protect ourselves?
So those at-home tests are extremely important because they allow access to people who may not have the ability to go to the health department or go to the doctor's office to get that test. But you are correct. It does make it to where the numbers aren't a 100% accurate reflection of COVID within our communities. So we do want to make sure that people know that they have those tests available for free at all 10 of our county health departments. They can go pick them up at any time that the office is open, and they do not have to pay anything for them. And that makes it to where it's a lot easier for them to know if they have COVID. Now, one thing that we do see a lot of in South Georgia is people who want to say, oh, well, it's just allergies, or, oh, something's blooming. And that might be the case. You may be absolutely right. But these at-home tests do allow people to know for sure whether or not what they have is COVID or allergies. And we also want to remind everybody that if you do have symptoms and you do test negative, it's always best to test again in a day or two just to make sure, because, and Stephanie can speak to this a little more, but I know some of the variants aren't showing up as quickly on tests and things like that. And so you never want to, take that first negative as a 100% confirmation you don't have it if you are symptomatic.
Yeah, the amount of virus in your system is very individual. So it's definitely possible to have COVID and test negative, even if you go to the doctor and get a test. And as Kristen said, the at-home tests are very important. It's a very important tool. It allows you to assess your own risk and your family's risks and makes those decisions on just day-to-day things like work, but also, should you attend an event or something like this. And it does mean that the numbers that we're putting out are lower than the people who actually have COVID, but it's not really a new thing. Numbers have never been 100%, and they're not 100% with anything, the flu, anything you have. So we do have methods of assessing the COVID in each individual community without 100% of the data. So we just want to make sure that people are following what you would follow for any illness. If you're sick, you shouldn't be at work or at an event or at school, regardless of if you have COVID. You should be practicing proper hand hygiene. You should be covering your cough. Disinfecting, ensuring your workplace or where you're going is disinfected. Maybe stay away from drinking fountains and things like that. It's just very important for each person to assess their individual risk and their family's risk and make decisions based on their, are you high risk, or is someone in your household high risk? So.
Well, there also seems to be a lot of misconceptions about COVID too. Like, some people don't understand you can get it more than one time.
Yes.
Or that if you're vaccinated, you can still catch COVID. Can you kind of touch on those and what people should be aware of? Because I think some people think if I have COVID one time, I'm good. Like, you can, and I've met people that have gotten it 2 to 3 times since the pandemic first started. So what suggestions would you have for them?
So what we know is that getting COVID within 90 days of already having COVID is extremely unlikely. Most people are going to go well beyond the 90 days before they're going to get COVID again, 5 months, 6 months, 8 months. It's different for different people, and that's something that we're still learning. If you are in a high-risk group, if you are immune compromised, you are more likely to get it repeatedly or more quickly, and as the variants come out, as we learn about them, it is also possible that could change, but at this time we're still seeing that 90-day window. The big thing about vaccination, we obviously want to ensure that people are getting vaccinated. It's free, but the point of the vaccine is not to keep you from getting COVID necessarily. It's to keep you from potentially getting a severe COVID infection. They are very effective at keeping people out of the hospital.
Yeah, no, obviously that's an important thing. There's many things that can happen, for the hospital could have a surge of something else. We live right on the interstate, and if we can keep you at a hospital with a shot, then if we have a major accident on the interstate, we're not clogging up the rooms for somebody who may not need it because they went ahead and got a shot simply, and it's free, just like the test. So.
Yes, that's definitely something that we've seen across these few years of COVID. We've seen during these surges the hospitals becoming overwhelmed and not being able to treat those people that they would normally be able to treat. I mean, pregnant women not being able to come in and get their inductions or not be able to be seen as quickly as they typically would. Individuals who need a surgery, but maybe it isn't, an emergent surgery, being delayed to get that surgery. And so that's something that we need to remember, is that while these COVID vaccinations may not be 100%, no vaccine is, but it helps you prevent that serious illness and hopefully keep you out of the hospital and allow other people who need the hospital to be able to get those services. We want to keep it as low as possible, the rates within our community, and the vaccines help us do that.
And by doing that, you're not only helping yourself, but you're helping your own community.
Absolutely.
So are you still seeing people come in to get the shots, or are you seeing groups of people coming in and getting the test? What is that looking like day to day?
So unfortunately, we have seen a decrease in the last several months of people wanting to get vaccinations. We are seeing people coming in to get the boosters, especially those high risk populations. A lot of those people are coming in basically as soon as they qualify to get the booster. We are, of course, struggling to get new people to get vaccinated. We were very thankful whenever the notification came out that individuals 6 months and older could get the vaccine. So that, of course, did open up a new population that could get the vaccine. But unfortunately, we are seeing that decrease. Now, we do testing in all of our health departments, of course. Lowndes and Tift are the only ones that have set days, but all of the other health departments do them basically on you call, you get a test. And so they have seen a recent uptick in individuals coming to get tested. We aren't doing the large testing events anymore, which we are thankful for, and we hope to not go back to that.
Absolutely.
We would love to not get back to those numbers, but we are offering those tests every day at our health departments, and so we do want to remind people that if you don't have those at-home tests, if you don't feel comfortable administering the at-home test, we do offer those tests at the health department at no cost.
And I do have a question, because I know we've been asked by people in some of our meetings with the city, if you want a booster shot, a lot of questions that we get at the city is, do you have to have the same type of booster from the same vendor like for instance, Moderna, like would you get the same booster? Because we've been asked that a lot, and of course I don't know the answer, but
It is recommended that
Okay.
you, if you have Pfizer or Moderna, that you stick with Pfizer or Moderna. Obviously, with the Johnson & Johnson, you would be getting a booster of Pfizer or Moderna. But it's not necessary
Okay.
to have the exact same.
I got an original Moderna and I got a Pfizer booster just because that was available at the
Okay.
time. So it is recommended, but it is not required. If you have a really strong stance that you got Pfizer the first time and you really want to get Moderna now, we just want to make sure that you get that booster.
okay. That seems to be a misconception sometimes with the booster versus the original vaccine.
And I guess, are people getting second boosters, or where are we at on that? I mean, I have a booster after, I don't even know how long ago it was, but I think back in November I got a booster. But for those who need a booster or who have had a second shot, I think my mom, who is immune compromised, she got a second booster. Is that correct? Is that possible for some people?
Yes. So it's important to speak to your doctor or go on the CDC website. You can actually put in what vaccine you received, when you received it, and it will tell you when you should get a booster. But generally speaking, for most of us, we would get one booster if we had, especially adults.
Okay.
And then anyone who is I believe it's 55 and up, but
Again, double check the
that.
CDC's
Double
website
check
because
that.
those
Yes.
guidelines are changing
then
constantly.
you would be eligible for a second booster, or if you are immune compromised, which, your doctor should let you know if you are considered immune compromised, and then you would get a second booster in that case as well.
And I guess to go back to the vaccine is available to what, 6 months and older. So for those parents who are considering that, I guess what would you say to a parent who has a kid in that age range?
I mean, I would say that they should speak with their doctor, because that's always going to be the first stop when you're making medical decisions for your children, is to speak with their doctor. However, the CDC does recommend that everyone 6 and up should be vaccinated for COVID. Generally speaking, kids have been in a lower risk group this entire time, but they may live with people who are in a higher risk group, and we also don't know what further variants will be. If they will be more severe or less severe, so it's just always a good idea to get your vaccine.
Now, I guess if I'm interested in getting a booster, I'm interested in getting the COVID test, the free test that you guys hand out, or any other services from the Department of Health, how do I get in contact with you guys?
So you can access all of the information on the services that we provide on our website, www.southhealthdistrict.com. If you're wanting specific information, add a /COVID-19 to that web address. You can call your local health department. You can stop by your local health department, and they're happy to answer questions there as well. But again, all 10 of our county health departments have those free COVID tests that you can take home. There's not a limit, though we do, ask, don't go pick up 20 and then try to sell 15 of them, because we're going to get a little suspicious.
Right.
But, we want you to get that test. We want you to come to us to get tested if you don't feel comfortable doing it at home, and make sure that you're getting that vaccination, that booster, as quickly as you can if you qualify and if you want it and if you need it. So, but again, our website, www.southhealthdistrict.com, and then southhealthdistrict.com/COVID-19 for the COVID-19 specific information.
Okay. Is there anything else that you guys want to let people know about this recent COVID surge? Obviously, it's a lot better than it has been, but any surge is not a good surge. But anything else you want people to kind of know about what's going on with COVID?
So the numbers that we're seeing now, while they are not as high as we have seen in the past, they are significantly higher than what we've seen in the last 3 months. We've more than tripled our numbers in the last 3 months. And just in the last week, we've had over 700 cases in our 10-county district. And so that is a significant increase over what we were seeing a few months ago. COVID is very much still within our communities, and Stephanie's already touched on this, but we want to remind everybody of the importance of staying home if you're sick. Again, yes, it might just be allergies. We know. We've lived in South Georgia too. But it might not be. And you don't want to go to work and get one of your coworkers sick and then them to take it home to their immune compromised family member. That's what we're trying to avoid. So stay home if you're sick.
Yeah. And get that test.
If you have any symptoms at all, get that test. And if you continue to have symptoms, get retested.
Well, thank you all for what you all do to inform the community and prevent this from spreading more. Because like I said, there's a lot of misconceptions out there, but we try to do a good job of sharing that information to our people too on our social media. So thank you all for what you guys do.
Thank you. And thank you for helping us spread the word. Following reliable sources on social media is very important this time.
Let's Talk Valdosta is a presentation of the City of Valdosta's communications team. You can download this episode and previous episodes on Spotify and Apple Podcasts. Follow the City of Valdosta's social media accounts to learn about future episodes.